Get your backpack. Way to go. Don't forget your homework. Okay, and clean your room. We have company coming tonight.
Oh, man. Oh, my homework.
Come on, Billy. We've got to get going.
Gosh, I was looking for this. Took weeks for me to find this. And there. Awesome.
Come on, Billy. Let's go.
Oh, yeah.
You have your homework?
Mm-hmm.
Good morning, class.
Good morning.
Everybody please take out your homework from last night. I'm going to pass back your quizzes from last week. Nice work, Billy.
Thanks.
Do you have your homework?
No, I think I left it at home. But I did it.
Okay, well, bring it in next class, all right? Before we get started, did anybody have a chance to look up yesterday's question on Washington, D.C.?
Ooh, my mom and dad took me to the Air and Space Museum.
I'm sure that was nice, Billy, but if you know the answer, please wait for me to call on you. Anybody else? Susie.
Washington, D.C. wasn't always our nation's capital. Philadelphia was the capital before that.
That's right. In fact, our nation had two capitals before it. The first one was in New York City, and the second one was in Philadelphia. And then it moved to Washington, D.C., where it's remained for over 200 years. All right, we're going to have a pop quiz. Please take one and pass it back. You'll have 15 minutes to complete the quiz, and please put them on my desk when you're finished. Billy, you only need one pencil.
Okay. Whoa! So cool.
Billy, please take your seat.
Fine. Okay, gotta get this finished.
Okay, everyone, time's up. Pencils down. Please bring your papers up.
But I didn't finish.
It's okay. Bring your paper up anyway.
Hi, how are you? My name is Leticia Ceguera.
And my name is Denise Enriquez.
And today we're here to talk about ADHD. What is ADHD? What are the causes? What are the symptoms in adults and childhoods? The treatment, diagnosis, and interesting facts about ADHD. And the other day I went to a party. I didn't tell you that. I went to a party. We will have a blast.
But right now we're here to talk about ADHD.
Oh yeah, that's true. Sorry. Go on.
So what is ADHD? Back in the 1990s, it used to be known as ADD. which is attention deficit disorder. Nowadays, it is known as ADHD, attention deficit hyperactivity disorder. It is a disorder in the brain that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and continues into adulthood. ADHD is most commonly diagnosed mental disorder in children, but boys are more likely to have it than girls. It's usually spotted during the early school years when a child begins to have problems paying attention. It cannot be prevented or cured, but spotting it early, having a good treatment and education plan can help manage their symptoms. The estimated number of children ever diagnosed with ADHD, according to a national 2015 parent survey, is 6.1 million, and 9.4%. The numbers include 388,000 children ages 2 to 5, 2.4 million children aged 6 through 11, 3.3 million children aged 12 to 17 years old. Boys are more likely to be diagnosed with ADHD than girls, 12.9% compared to 5.6%. According to a national 2016 parent survey, 6 in 10 children with ADHD had at least one other mental, emotional, or behavior disorder. About 5 in 10 children with ADHD had a behavior or conduct problem. About 3 in 10 children with ADHD had anxiety.
And now we're going to continue to talk about the symptoms in children about ADHD. There are 3 different types of symptoms. We have the inattentive, hyperactive compulsive, and the combination of the 2 of those. On inattentive children, they are usually easily distracted. They doesn't follow directions. They lack of organization. They don't finish tasks. They don't seem to be listening. And they are often losing things. On the hyperactive impulsive, they often screams, fidgets when they are sitting. What this means, it can be just moving around, like it seems like they want to go to the restroom, but it's just they cannot be still sitting. Also, in the hyperactive impulsive, we have running all over the place, climbing, even they know they cannot be, they don't have control of them. They talk excessively, they cannot wait their turn, they are like very impatient. The symptoms in adults may change as the person gets older. On adults, it's more about forgetting things. They can have anxiety, they have impatience, usually at the point that they have problems with the work and relationships. They act impulsiveness that leads to anger, and also they have mood swings. The cause of ADHD is unknown, but they have several things that might lead to it. It could be the chemicals on the brain that are out of balance, toxins such as lead, and genetics. Genetics is probably the most common cause of ADHD. But in addition to genetics, scientists are studying other possible causes and risk factors, including brain injury, like frontal lobe injuries. On the other side, on diagnosis, it's very difficult to treat a children or a person with ADHD, because if you notice the symptoms that we just mentioned, it could be the symptoms for most of a healthy kid. So in order to diagnose ADHD, doctors discuss symptoms in a length of time. Like it takes a time to figure out if they have ADHD. That involves with the kid, the teachers, and the parents. That's why it says that the ADHD is usually diagnosed or figured out during the early years of school, because that's when they are interacting with other kids, and then teachers might notice that, and they call their parents, and it's a whole process of it. To confirm a diagnosis, A child may take a body of tests to check their neurological and psychological status. The test should be given by a pediatrician or mental health provider with experience in treating ADHD.
The Food and Drug Administration, FDA, approved benzedrine in 1936. Dr. Charles Bradley stumbled across some unexpected side effects of this medication the next year. Young patients' behavior and performance in school improved when he gave it to them. However, Bradley's contemporaries largely ignored his findings. Many years later, doctors and researchers began to recognize the benefit of what Bradley had discovered. Later, in 1955, methylphenidate was introduced and approved by FDA, being a psychostimulant that became more popular as an ADHD treatment as the disorder became better understood and diagnosis increased. The medication is still used to treat ADHD today.
Most children with ADHD receive some type of services. National survey from 2014 conducted by parents of children 4 through 17 years of age had ever been diagnosed with ADHD reported. Almost 9 out of 19 children had received school support, which includes school accommodations and help in the classroom. About 6 out of 10 children had received some type of behavioral treatment or skill training. Of those, it includes 3 out of 10 receive parent delivery behavior therapy. This is when parents become trained in behavioral therapy. 4 out of 10 receive social skill training. 3 out of 10 receive peer interventions. And 2 out of 10 receive cognitive behavioral therapy. Having ADHD does not mean a child won't have friends. Not everyone with ADHD has difficulties getting along with others. The earlier a child's difficulties with peers are noticed, the more successful interventions may be. Although researchers don't have a definite answer on what works best, some things parents might consider as they help their children build and strengthen peer relationships are: pay attention to how children get along with peers, regularly talk with people who may play an important role in a child's life, such as a teacher, school counselor, or healthcare provider. Involve your children in activities with other children. Peer programs can be helpful as well.
What is the importance of our profession as a therapist in relation to patients with ADHD? Studies have been conducted and show that techniques like massage therapy, breathing exercise, and aquatic therapy have been shown to reduce anxiety, stress, muscle tension caused by ADHD, and further promote relaxation and improve the quality of life.
Thank you very much. Hope you like this video. This is the end of our presentation.
Yes, and if you notice these symptoms on any children, do not diagnose on your own. Please reach out to a healthcare professional to get further help.
Thank you very much.